So welcome to this seminar to all the persons that are joining us. This is, I have to say, a very exciting seminar, part of a number of the ones we are going to have, ones that was held, two that were prior to this one organized at RISE, the other one organized at Southern Methodist University, and Texas Mission Food. And now we are organizing this one at the Center for US and Mexican Law. And it is a seminar around the publication of a book, The Future of US-Mexico Relation, that 2 years ago, Tony Payan, Jesus Velasco, and I were trying to conceive how to do it. And we were very carefully choosing the best persons to talk about different aspects. When we were conceiving the book, the idea was to try to project ourselves in the future. But this is something that we had never done until that moment, so we didn't know how to do it. That's why we had to seek also for experts in foresight and futurist methodologies that very professionally and really thoroughly gave a seminar to all the authors how to do it, how to use this methodology. So the purpose of the seminar today is, on one hand, to discuss about the health law aspects and public health aspects that were written in the book, the aspects that we were thinking about the future of US-Mexico relations from a public health and health law dynamic. And of course, before this part, we will hear from Andy Hines, professor at the University of Houston, in technology, and specialized precisely in futurist methodology, foresight methodology. So in this brief introduction, as this situation that I am both kind of moderator, but at the same time, the author of one of the chapters, I would like to very briefly, before leaving the panel to Tony, that will also join us in these welcoming remarks, express very briefly 4 elements and few elements of the chapter on health, and also, of course, inviting you all to buy this book. This book has been published at Arte Público Press. It's a publishing, it's an editor and publishing house that is at the University of Houston, and it was really a pleasure working with them. We have a collection that it's called Law, Policy, and Society. That is the collection in which the book was published. And if you want to look for it, please contact their webpage, and they will be more than happy to provide it to you. Also, if you are willing to know all the topics the book has developed, I invite you to stay tuned at RISE Mexico Center webpage, where you could see regularly where the different seminars that are going to take place, when they will take place, actually, and if you want to join us, because the topics are very large. This book was from immigration to border economics to political aspects and governance and sub-governance, health, as you were saying, energy and green energy. So as you see, several topics of what we call the future of US and Mexico relations. But let me get back then just very briefly, so that you know a little bit what we talked about on the health chapter. So 2 were the chapters, one on public health that Eva Moya, Silvia Chavez, and Peter Hortez wrote, and the other one on health, literally like health access and the provision of healthcare. This chapter was, we chose 4 drivers. One of the drivers was access to healthcare in itself, the second one, education in health, the third one, telemedicine and telemedicine services and providing healthcare, and the last one, health tourism. I want to, and we were discussing before launching the seminar, I want to highlight the aspect that we didn't deal with COVID, okay? We didn't deal with COVID because at the moment we sent the book for the manuscript for the publisher, we were in the middle of the pandemic, and actually the book was literally published, saw the light in the middle of the pandemic. But I want to highlight, nevertheless, the fact that many of the aspects that are dealt with are anticipating situation of communicable diseases, of the difficulty of providing healthcare, like for example, the one of telemedicine. So the scenarios, like Andy will explain better, but you will hear it from all the seminars we are organizing. We had, between the drivers or topic that authors would have selected, we would have to highlight 3 scenarios: the baseline or status quo, the most desirable or more integrated scenario, and the less desirable scenario. To give arguments for one side or the other, we need to find indicators that could be given in advance, so we are already anticipating, or indicators that might turn up that in the middle of these 20-25 years we were analyzing, and then justify other aspects that we would conclude. Very, very basically, because as you will hear from Andy Hines, it's a lot more complex than that, but I mean, very briefly, it's really the 3 words: driver, indicator, and scenario that we had in mind while we were writing. So between the US and Mexico, there is interesting comparison in terms of access to healthcare. The United States do not have, in the United States, there is no specific provision in the Constitution that highlights the fact of granting an access to healthcare. There is an authority to protect healthcare and providing for safety that can be associated to the 10th Amendment, which is the general clause related to the tax system. So, but it's on the welfare aspect, but we really need to make it fit. There is no specific provision in the Constitution of the United States that says everyone has the right of access to healthcare or to health. Instead, in Mexico, yes, we have at Article 4 of the 1917 Constitution, we have a specific article that says everyone has a right to health. So this is first a big initial comparison between, and that helps us understand why in the United States, the system, it's the one it is. And we studied it in the book. So with the Obamacare that it's installed, with Medicare and Medicaid system helping certain types of person having access, certain type of person according to the income they have, having access to healthcare. And on the side of the Mexican system, there's the public system. In both countries, we have public healthcare system and private healthcare systems. Pretty much we agree that in the future we see a coexistence of both. And maybe a more recognition or larger recognition in the United States of the fact that health can be a right, or that health can be at least a principle that should lead society. Because the idea of putting health or granting through national healthcare system health to citizens, it's because we consider that health is too important as to just leave it to the business mechanism or proper mechanism of a business market. Of course, we wouldn't conceive any of these systems. We discussed in the chapter about the universal access, the notion of universal access parallel to a system of private health, and how this notion is sometimes difficult to define. And why it is difficult to define? Because unlimited right to access healthcare, it's fiscally unsustainable. This is something that we have to know from the beginning. An unlimited right of access to healthcare is fiscally unsustainable, but maybe there's specific healthcare acts that could be covered regularly, such as we have education coverage in the United States, and larger or more specific medical acts could be, of course, falling into the proper patrimony of the person that decides if they decide to move on that. In the book, we will do a small comparison between the social security systems, the Bismarckian system, the Bismarck, the one created by Bismarck in Germany, and is through labor that it's granting the access to healthcare, labor detraction from the salary that allows a person to access healthcare. And on the other side, we have the Beveridge system, the UK congressman that launched in the middle of the 50s of the 20th century, this notion of having access to healthcare, not based on the labor dimension, but based on the nationality. And moreover, in certain countries, based on the citizenship. So that would mean that every person, by being national, would have a specific access to healthcare on specific medical acts. of a very specific aspect that currently happened on the US-Mexico relation that work, there's also the role of the Mexican diplomacy. And in here, in the chapter, we highlight what happened with the Tuxpan-Tula pipeline when it exploded, and how in January 2019 in Hidalgo state in Mexico, and the Mexican consulate in Houston worked very thoroughly and in real time to bring 4 children to Swinner's Hospital in Galveston. And they were, of course, we needed the consulate, or at least the foreign relations, because visas and the access in the country would have to be granted in really the speed of light, because these persons were on a life or death situation. And it's what it happened. Indeed, it was a very successful relationship. Unfortunately, not all of the 4 children survived, but not because of they didn't receive the care, but because of the critical condition they arrived. But at least it really showed how they can be an integrated collaboration, and this could be the embryo of what could be a US-Mexico relation, health access to healthcare cooperation, and that really worked when the motivation and the intention was there. Also in the chapter, then, and almost finishing my ideas, there is a comparison about what is the GDP invested from both countries in healthcare. And of course, Mexico is improving, but still did really important improvements, because we have to say that in 2018, we had 15% of the population in Mexico that didn't have access to healthcare, which is of course not acceptable, but we have to say that in 2010, it was a 42% of the population that didn't have access to healthcare. So I think that there's an important improvement in 8 years, from 42% to 15%, but still Mexico needs to do very large improvements in his GDP. He's actually investing 2.79, or around 3% for this year, I believe, percent in his of his GDP in allowing access to healthcare. With 123 million inhabitants, we can compare in Europe, for example, to France, that dedicates 9% of its GDP, almost 9.5% of its GDP, for a population of 67 million inhabitants. So we can see how Mexico, if they want to, if Mexico would like to grant more access to healthcare to his citizens, needs to invest a way larger part of its GDP in healthcare and in access to healthcare. The United States is a very controversial country, because, you know, we are primarily, and even in the analysis, I can tell you, I found many of the controversies in there, because it's a country in the world that does the biggest expense per capita. So the United States is spending per citizen $8,329 in terms of healthcare. Instead, we have a private system, as we know, with insurance companies involved, and with co-pays also, and sometimes important co-pays involved. So there is this part that the public expenditure to healthcare is very large, 21% actually, in the United States. It's around 21%, but there is, so this expenditure per capita, but we still have a very, very complex system of private and private institutions around, and specific program of, as I said, Obamacare, Medicare, and Medicare that justify this expense. Besides the access to healthcare, education in health, it's something that we see that should be something in the future of US-Mexico relations, from habits, tobacco, drugs, medical emergencies, alcohol restrictions, how we could teach the kids since the beginning, so that the population gets into their mind how important health is, how important it is to have autonomy until the longest in our lives. And to have autonomy, we need to do sport, we need to eat well, because food is crucial. And we have to know that. We need to what we eat is at the end what we, the energy we produce, and we have to take care of those things. And this comes through the education in health that could start at schools. In this education in health, we can, of course, take into account aspects that might be more controversial, but I need, in my view, I consider in my view that need to be addressed. So the biological differences between sex, the fact of fertility, the fact that men know about the fertility of women, so we can know better how to avoid unwanted pregnancies, for example, for children, for teenagers, sorry, and so and so. So, and also I approach at some topic at some moment from a neutral perspective, because it's also a notion that it's very controversial in society nowadays, how from the perspective of abortion and euthanasia can be the evolution of the law in that sense. Telemedicine, of course, we have seen it with how the companies that were investing in telemedicine skyrocketed during the pandemic, because it became a way of addressing problems from patients talking to their physicians. So telemedicine is something that we saw a very large integrated aspect. We highlighted a discussion about a problem that exists so far in the United States, and I hopefully soon will be amended, about the licensing of physicians that are now able to provide medical services away their state where they are licensed. So try to suggest a national licensing that would be a license for a physician that could be working all over nationally, and every physician would be able to provide medical advice and to provide medical care online in wherever in the country it would be. I found actually a contradictio in terminis, a proper contradiction, to insist that in telemedicine, to be able to give advice, a physician in Texas to a patient in Los Angeles, in California, it wouldn't be possible. It should be done through a cooperative way between physicians. So I think we need to, at some point, to reform that aspect. Health tourism as well, although COVID has seemed to stop pretty much human movement, and we will get back to that, and people will get sick in countries where they didn't live or that they don't live normally, or even better, as we said in the chapter, citizens will travel, especially to undergo surgery in another country. So citizens in the US that go to Mexico to receive medical treatment, because of the differences, of course, and to avoid their premium from the insurance company to rise. So this health tourism is also top. And as a conclusion, I make a proposal for a binational healthcare model for the United States and Mexico, combining systems like a free choice of doctor, free choice of hospital, the possibilities of what is primary care and how it should be developed, healthcare education, but also healthcare coordination, so that we know between the systems, within hospitals, there is this unique medical records that can be used by the patient when he travels away, and he has his own medical record that could be shared. So pretty much what I wanted to tell you, I went a little bit beyond my time, but I really wanted also you to have this idea. Without further ado, I would like to give the word to Tony and then to Andy. Thank you very much, Tony.
Thank you, Alfonso. It's a pleasure to be here. We worked on this book very, very hard. I have it in my hands. I have a copy of it. I think the very first order of things, and I'm just going to say a couple of things for a minute or two, is to thank our partners. I mean, we have actually worked quite well. The University of Houston's Law Center, the center I direct at Rice University, the Center for the United States and Mexico, of course, the Mission Foods Mexico-Texas Center at SMU, the Escuela de Gobierno y Transformación Pública at the Tec de Monterrey, the Universidad Iberoamericana was a partner in this exercise, and of course the Universidad Autónoma de Nuevo León, specifically their law faculty. We've done these exercises before. The first book that we published in partnership, not all of these partners, but most of them, certainly the University of Houston Law Center, was a book in 2014, 2015 on energy reform in Mexico, when Mexico was looking ahead at reforming and modernizing its energy system. I think it was the first truly comprehensive volume on that reform in Mexico. And then after that book was done, published, and presented, we decided to engage another topic in partnership. I am a big believer in partnerships to do projects, because I think the reader of the book gets a lot more when it comes to specific issues if they get different perspectives. So 2.5 years ago or so, we began to conceive this book, and as Alfonso said, we looked to figure out what the relationship was going to be. As you all well know, the US-Mexico relationship had been framed by the vision that Carlos Salinas, as demonized as that president has been, Carlos Salinas had a vision for North America and the binational relationship in 88 to 94 in Mexico. And of course, he managed to convince the then George Bush Senior White House to engage in a free trade agreement, the North American Free Trade Agreement, which has now been substituted for the USMCA. This was an idea that Mexico put on the table at the White House, kind of crafting a vision for the future, and that prevailed for about 25 years. 2016, however, brought a very unconventional presidential candidate in the United States, Donald Trump, who eventually won the elections. And of course, in Mexico also, there were also, stirrings of a very sui generis type of populism in the campaign from 2017 with Mr. López Obrador, who eventually won the elections in 2018 and took office in late 2018. And I think that their approach to the binational relationship is radically different than the approach that was set by the much maligned Mr. Salinas and Mr. Bush Senior. So clearly we're in a new era, and that's what motivated the conception of this book. If we had a pretty good idea of the vision and the trends and the indicators and the factors that mattered in the last 25 years, what are those factors? What are those issues that are going to matter in the next 25 years? Some of the authors shied away from 25 years. They thought it was too long of a time horizon. I'm not an expert. Andy will talk to us about the methodology, but there are different kinds of strategic foresight: the short term, the longer term, the deeper and the more shallow, and there's different ways of approaching it. The challenge that Alfonso, Jesus, and I presented the authors of the book was to try to look 25 years ahead as best as they could. And many of them did. Some said, well, I can do 20 years, and some of them said, I can do the next 10 years. And at the end of the day, I think we all addressed anyway the future of the US-Mexico relationship and laid out the factors that I think are going to matter. At the end of the day, I think the project is worth it because I think that we do several things. One, we examine the past trajectory of the relationship, the things that have actually mattered, and where we think these are going in different scenarios. And then, of course, we have a normative commitment in the book, in this particular exercise. I don't think, and Andy may correct me in a minute, but I don't think that we do foresight exercises without normative commitments. We do want to know, avoid the worst scenarios, and elicit the best scenarios. So there is an intention behind these kinds of exercises. And we wanted to commit to detecting the potential dangers of the landmines of the binational relationship in the next years. And I think some of the chapters do it very successfully. And of course, we wanted to identify the opportunities, because then that way we can lobby, so to speak, in a loose way, since we're think tanks and not allowed to lobby, to make the changes to elicit the better scenarios, to manipulate the variables that are ultimately going to matter quite a bit, that are going to have the greatest weight in the binational relationship. And I think the exercise at the end of the day, after a couple of workshops, a workshop on strategic foresight methodology, several discussions among us, and the very hard work by Lisa Wakita, the program manager at the US-Mexico Center. We academics collaborating in this project, who are often much like cats, very difficult to herd, turned in the chapters, reviewed them, reworked them, and here it is for your enjoyment. As Alfonso said, one more observation: we didn't expect the COVID. I mean, the black swan events, the things that are going to show up and are going to completely upset your timeline, The ones that you cannot predict, like a pandemic, are not considered because the chapters were finished before March of this year when we began to realize the dimensions of the pandemic. Nonetheless, in spite of that, I think that we were sufficiently visionary in our understanding of the more structural variables that matter, that the pandemic is actually not that substantial to what is going on in the binatural relationship. In the chapter that Daniel Titchener of the University of Oregon and I write, for example, we think that much more important, much more so than the pandemic, is going to be, for example, the political behavior of Mr. Trump and Mr. López Obrador. And that, I think, in one of the scenarios changes with the elections that we will have in the United States in 3 weeks. And that's going to be very important. So the pandemic is both a factor, but it is also a challenge to manage based on those factors. And so this is one of the, I think, one of the most important lessons of the book, that it does address the issue of the need for greater cooperation without addressing the COVID-19 crisis directly. And I think that's what the methodology does for the book. It rescues our exercise from becoming immediately obsolete, I think, because we all of a sudden had a kind of a black swanish event show up in the horizon. And so I think it's a very valuable thing. There are lots of data, lots of analysis, lots of good insight in the book, in a methodology that I think it's worth rescuing for many, many exercises in the future. And Alfonso and I are already, and Jesus are already thinking about what is our next project. So we'll let you know. Thank you, Alfonso. It's a pleasure to be here. And thank you, Andy, for your help with the methodology of the book.
Thank you so much, Tony. No, thank you very much. I would, without further ado, I really appreciate your words, and you could have said it better, but I would like to introduce Andy Hines to all of you. So Andy is an associate professor of the program and program coordinator at U of H graduate program in Foresight. He has a PhD in future studies by Leeds Metropolitan University and an MS studies of the future at U of H. And he has a BA in history and political science by Salem State College as well. So really, without further ado, Andy, please go ahead. Thank you so much for being here.
Okay. Thank you for having me. So let's do the future in 10 minutes. We can do it. It can be done. All right. So we'll start with why do people use futures, right? And of course, it was laid out nicely why it was useful for the book. We guide policy, early warnings, innovate, new stuff, strategy. We're starting a project on Monday with the CDC. So health policy is an area that, of course, importance to the future. And they want to get better at identifying early risks. Now, I'll give them credit. It was before the pandemic hit. So it took a while to negotiate the project. But you can see that the future can help do better policy, right? Okay. So that's some of the reasons why. This is the complicated version, the 6-step process. There is a framework. It's validated by the Professional Association for how one explores the future of a topic. Here's what we did in the book to keep it simple. We basically said, break your sections into 3. The introductory section basically said, it's kind of the background. How do we do the topic? How do we find change? And what was the kind of the research approach that we used? We took that research and synthesized it into what we call a set of drivers. And I was so pleased to hear that in our introductory remarks. The key factors of change in a topic area, we call those the drivers. And then basically we tell stories about how those drivers might interact and create a different future, right? And then of course, we got to bring it all home and say, so what? All right, if this is what the future looks like, what do we do? What are the recommendations? What can we do now in the present to work towards the future we want and work away from the one we don't, or the ones we don't want? So let's just start with a little bit about some of the guidance we provided for that sort of upfront setting the stage. One of my favorite slides is this idea of time horizon. We use a 3 horizons approach. And of course, timing is a big thing for the future. Our time frame was 25 years, which is, as pointed out, it's a good, healthy look into the future. So if you look at the y-axis, strategic fit, how well do we understand what's happening? we say in this first horizon, the next 2, 3, 5 years, our strategic fit is high. That is, we kind of know what's going on in the present, we hope. But we can also, if we do our homework and we look hard, we can see what is the second horizon or the major alternatives or shifts. We can see them, we just can't see them as clearly as the first horizon. But if you do your homework, you study your topic, you will know what the major potential shifts are ahead. And that's that second horizon. And then really our authors in many cases went way out to that third horizon. What's the new system? And you can see, we can barely see it. The strategic fit with the third horizon is very low. The signals of change are weak, but we can get some ideas about what that longer term future could look like. And the way the future works is when we first spot a signal of change in the third horizon, it eventually makes its way to the second, and it eventually makes its way to the first. To give you a quick example, we had our 25-year time horizon, right? I thought back. One of the first projects I worked on as a futurist was in self-driving cars. And it was back in 1993, which is 27 years ago. So 27 years ago, I went up to General Motors and started working on self-driving vehicles. And it's taken that long for that change. But eventually it has become, to the point where we are now seriously considering that. So sometimes the future takes longer than we think. A 25-year time horizon might be shorter than we think. When we're scanning for signals of change, we say, all right, if we're going to understand our topic, U.S.-Mexico relations, what are the categories? Where should we look for in a sense, where should we look for the future? So we create we call them a bubble map. And basically, how would we map out the topic, the categories? And I wanted to point out this little ring of yellow bubbles. The acronym is STEEP, for social, technological, economic, environmental, and political. And that's the larger context into which the topic will be set, right? So what's going on around the topic that might influence the topic? How might new technologies influence the U.S.-Mexico relations? One of our authors did a very nice domain map. Congratulations, thank you, it looks great. And you can see that they included STEEP, the STEEP category, and then they identified 4 different categories that they said, if we're going to understand U.S.-Mexico security, these are the topics that we need to look at. And there you go, you see pandemics in there. So our authors did a nice job of mapping out their topics as a way to look for the signals of change. And as part of the research, it was mentioned right up front that, hey, look, we're futurists, and you saw I have a degree in history. I like history, right? And history is important. If we're going to understand the future of a topic, history provides us some clues, not answers, but clues, right? So we look to recent history to kind of set up our topic, current conditions, what's the current state of the topic. So before we look to the future, do our homework on the past, get ourselves set in the future, and then of course, who cares? The stakeholders, and we do an analysis of who is vitally interested in the topic. So our looks into the future, our stories about the future are not based on sitting around and dreaming up big ideas. It's based on research. And we asked our authors to do their homework, do their research, and you'll see in the book they did a wonderful job of that. So I wanted to, in terms of the stories about the future, the one key idea, if you get nothing else out of this brief talk, is that we have pretty much proven that we can't predict the future with any accuracy. What we can do, however, is map out a pretty good set of plausible alternatives. And then, as was mentioned in the beginning, we look for the indicators that say, hey, which way is the future actually unfolding? So our goal isn't to necessarily predict the future right, get the right scenario, but it's to expand our thinking about what's possible or plausible so that we can start, again, moving towards the futures we want, moving away from the futures we don't want. Whoops, went the wrong way there. So I talked about this idea of drivers, right? And when we do the research, it's kind of like themes, right? The themes that we see from our research. This is a wonderful example of a driver. It's from Arab, who does a bunch of Foresight work. If you'd like to see a pretty set of drivers, you can click on that link. In this case, the driver in that topic area was something called green infrastructure, right? And there's different kinds of drivers. Some of the drivers kind of pull us towards the future. They're not quite here yet, but something like zero waste. It's not here yet, but could it but it's a compelling idea that's, if we say it's pulling us into the future. Some of the drivers are already in evidence. They're pushing us towards the future. All the things about the triple bottom line would be a good idea, a good example of a push. And then there are weights of the past. There are some drivers that are kind of holding us back, keeping us in the present or even the past. So in the we asked our authors to do drivers, so I thought I'd pull out some of the some examples. I just went through the chapters kind of at random. We had demographic change, disaster response, immigration, legal nature, federalism, urbanization, democracy, the fourth industrial revolution, which is all about the big technologies that are coming, the role of income distribution and judicial reform, impact of civil society. We heard about health tourism right up front. I agreed that that was a really interesting driver. And then the trade in fossil fuels or energy. So you can see that the authors, to tell these compelling stories about the future, you need to understand like what's shaping the future. Okay, so those are our drivers. And then we used a technique called archetypes to tell the story, and those are basically patterns of change. We saw we introduced 4 basic patterns of change. The baseline says, what's the future look like if there are no major surprises? We call that the least likely future. Collapse, what happens if it goes bad, right? The negative future. It's possible, right? It needs to be considered as a way to avoid. New equilibrium, there's a shift. We call this the new normal scenario, which you might have heard of. And then finally, transformation, which is a new system. And if you look out 25 years like we did, you start to get into that realm of what does the new system look like? We're in a current system, what's the new one look like? So we use those as kind of guidelines to tell the story. Here's an example, a snapshot, a screenshot from one of the authors' scenarios where they did versions of the 2 versions of the baseline and then a third alternative called war or armed conflict. I hope that that's a collapse scenario. Okay. So we told stories about the future, and then we wrap it up with what are the implications of those stories and what should we do about it. So without getting into the convoluted methodology, the thing that we try to get to in implications is if something happens, what happens next? What happens after that? And we talk about 3rd order implications. So we don't just think of the obvious changes in the future, but what are the sort of less obvious changes? In the case of the self-driving vehicles, one of the less obvious changes that we got using this exercise is what happens when self-driving vehicles, we don't need downtown parking garages, and they pay a lot of fees to cities who are going to miss that revenue. And when it's, when revenue is missing, people pay attention. So some of the recommendations that I went through the book and pulled out from the various authors. You see one about setting up a binational commission, strengthening capacity through various kinds of education training, more resources to universities and think tanks, a border bank for human capital, regional cooperation for migration, sharing of data, working together on climate change, a proposal for binational healthcare model, and another one to establish a North American renewable energy market. So these are just headlines. But what the authors did, based on their research, deriving from the stories about the future, the scenarios about the future, they said, all right, here are some things that to deal with this world. Here are the kinds of things that we could do to respond to that world. So I'm going to wrap up. I'm going to just tell my three benefits from doing this kind of work. And this the first one, get beyond the current turbulence, is 25 years is a long, it's fair enough. 25 years we won't be thinking about the things that we're thinking about today. We'll have pretty much forgotten the pandemic in 25 years, right? So what does the future look like beyond that? So the long time frame gets us out of the current turbulence. It provides us tools. We call it the VUCA world, right? Volatile, uncertain, complex, and ambiguous. And we say, this is the world that's here to stay. So we better get some tools to deal with that. And again, I think if you do your 3 Horizons homework, you won't be surprised. I mean, we may not know the timing, but we won't be surprised by the arrival of these new phenomena. So I think that's what we were trying to achieve with this book. And I was really happy to see how the authors did their homework and kind of followed the guidelines that we provided. So thanks for that, and I'll turn the mic back over to Tony, I guess, or Alfonso. Okay.
No problem, no problem. Thank you so much, Andy. Really, I get this. I will keep in mind the fact that in 25 years we would have forgotten about COVID, and this VUCA acronym, that it's really, really very enlightening. No, so when sometimes we get lost in the tree and we don't see the forest about where we want to go. So, but thank you so much. Without further ado, and of course, I forgot to say to any person that it's as a participant, you can either participate through the chat, or at the end we will leave a couple of minutes for questions and answer. Please feel free to interact. So I would like to introduce, without further ado, Eva Moya. Eva is associate professor at UTEP. She has a PhD at UTEP as well. She's at the Social Work School of Health Sciences. She has an MS in social work by UT Austin, a BA at UTEP as well, and a licensing in social work by the state of Texas. So I would like also quickly to present maybe Silvia, and you share the time if you want. Eva, so Silvia Chavez, she's a lecturer and postdoc as well at UTEP, PhD in psychology at Instituto Humanista de Sinaloa, Master of Science in Child Psychology at the Instituto Humanista de Sinaloa as well. She has what we say in Mexico, licenciada, una licencia en psicología, meaning a degree in psychology by the Centro de Estudios Universitarios, and she focused her research in health. Well, thank you so much, Eva. Thank you, Silvia. Without further ado, the panel is yours.
Thank you so much, Alfonso, and thank you, Andy, and thank you, Tony. And I just want to check, we have approximately 10 minutes, right?
Yes, we
can. We have the rest of the day.
No, not the rest of the day, but I think
okay.
As we left like 5 to 10 minutes before,
Perfect.
So that participants, I think there is no harm to leave 10
okay.
more minutes after the time.
Excellent. Okay, so let me first of all disclose the following. This was actually my first experience doing strategic foresight. So I come away not only with a writing, with a contribution in a book, but most importantly now with the tools and the ability to bring it into my classroom so that students that are training in the area of social work and social justice are not only thinking about the present, but they're also thinking about the future. So I just want to let my colleagues know that already my brain has shifted and is rethinking the way that we look at health in a much more broader way. Second, I really liked our chapter, and let me tell you why, because I think we brought incredible talent and expertise. So Sylvia comes from psychology and a very humanistic approach, primarily as an expert in mental health. And my colleague, Peter Hotes, who's not available today, but who is, in my opinion, one of the greatest minds surrounding viruses and is right now at the forefront of COVID vaccine work. And is also a celebrity who gets interviewed constantly by CNN and other broadcasts and media. Last time I heard Peter speak was in BBC News. I think that what we try our best to do in this chapter is to interest the readers into understanding that there are multiple drivers when it comes to US-Mexico border relations, but 7 are the ones that we are the most concerned. Where we see both big challenges, but also great opportunities are the following. The first one is that of mental health. Understanding that about 1/4 really of the population within the United States and approximately about the same percentage in Mexico are presently experiencing some type of mental distress. That type of mental distress is close to a mental diagnosis. Unfortunately, these diagnoses are not adequately documented, and therefore they're not adequately treated. And so therefore we talked about the 3 different scenarios of what's going to happen if we don't do a better job. 1, of screening early. 2nd, of removing stigmas that are associated with mental conditions. 3rd, providing access to adequate care. 4th, training the behavioral mental health workforce that we need to do so, because if we don't, we're going to pay significant price. Now, keep in mind that COVID was not present, as my colleagues have said, when we were writing. However, with COVID, actually, I almost have a 4th foresight scenario, which is almost every COVID family and healthcare professional or other individual that has been impacted by the virus is now impacting at least 8 to 9 other members of a household. And so therefore, and I'm not only saying transmission, I'm saying prolonged grief, prolonged stress, and multiple types of losses that are associated with the diagnosis and sometimes the loss. So mental health is going to continue to be a very significant driver. The second driver explored in this chapter is that of chronic metabolic disease. I want to spend a couple of minutes here because, again, chronic metabolic disease is sort of like this group of conditions such as diabetes, hypertension, and high cholesterol, which love the company of other conditions such as tuberculosis, for example, and we have seen it in the data for COVID. Almost every loss of human life that we have had associated with COVID has an underlying condition, of which primarily the chronic metabolic diseases are prime. So diabetes type 1, we know that type 1 accounts for about 85% of the chronic metabolic conditions. We know that it's highly associated with high blood pressure or hypertension. We know that approximately 12% of the adults in the United States are living presently with diabetes. And we know that we have high mortality due to diabetic complications in both US and Mexico. And in 2016, just alone, we had 86 million people, about 1/3 of the population with pre-diabetes. And we also know that 10% of them will develop diabetes within the next year of their pre-diabetes, and about another 70% of that number is going to eventually develop diabetes anywhere between 9 to 10 years. And so what do we have here? We have a time bomb. We have a condition that if we don't address early by modifying the way that we eat, the way that we live, the way that we move, the way that we interact, if we don't have the policies in place to reward healthier behavior and practices, if we don't make food that is healthy, accessible, affordable, and available, if we don't screen for risk, if we don't treat on an integrated fashion, diabetes is going to be la reina or the queen of expenditures associated with medical care, and it's primarily going to be catastrophic in nature. So we have our work cut out. The scenarios that we lined up say, if we don't cut obesity, if we don't cut the high consumption of fats, if we don't become much more physically active, if we don't address hot climate, and we don't build environments that are healthy and that are comfortable and that really promote healthier lifestyles, if we don't address chronic stress, if we don't have policies that are consistent with rewarding the right behavior, and if we don't protect Medicaid and Medicare, and we don't train adequately health and human service professionals, and on top of that, we need mental health professionals that are able to work with individuals that have diabetes and complications, we're really going to have a significant public health financial crisis for both the United States and Mexico. So by 2034, our projection is that we could have anywhere between 44 to 45 million individuals in the United States living with diabetes, and the expenditures might be, and this is a conservative figure, $336 billion. So that is to sort of give you an example of one of the scenarios that we took that and we said, okay, if we don't do nothing, sort of like where we are, the baseline, the worst, and then the best. So the good news is that there are things that we can do and do very strategically, but it's gonna require great political and public support in order to do that. The third scenario is that of demographic trends. Good news, we're living longer. However, the patterns of lifestyles and disease are looking different. And so therefore, our mortality is changing. The bad news is that yes, we're living longer, but we're not necessarily living healthier. And therefore our living is becoming much more expensive. So it's very clear that the population growth of the US-Mexico border, the population will most likely double within the next 20 years, unless we have significant mortality impacts. And if we are gonna double, then the question is, do we have infrastructure? Do we have services? Are we adapting education? Are we working in workforce opportunities to allow for these population growth to take place in a way that is really healthier and that we allow for thriving populations? The fourth is poverty. I could spend the rest of the afternoon, but I know you have plans. US-Mexico border by nature is socioeconomically poorer actually than many other areas from within the US and Mexico. Different the case in the southern part of Mexico. It's interesting that on the northern part of Mexico, we say that we have greater access to wealth as compared to the central and south. But in the case of the United States, it's the opposite. So poverty, if we don't address the root causes of poverty, most likely we're going to grow in distress, and therefore we're going to grow in health and socioeconomic inequalities. The fifth driver is that of human migration and trade. And what we basically do here, and my colleague Peter was fantastic in saying, you know, there are emerging and neglected diseases. And he references the ones that are very prevalent, and that the moment that we put our guard down in public health, most likely we begin to see. He also reiterates that if we continue to migrate, which we are, that's not going to stop. We're almost right now at the sixth continent in terms of human mobility. More likely, there are going to be increased animal reservoirs. There's going to be increased trade. There are going to be greater vectors. And at the end of the day, there's no wall that can keep vectors and diseases and bugs and viruses from understanding which word is north, south, east, and west. The sixth scenario is one that is also very worrisome, which is that of the anti-science and anti-vaccine movement, which is right now, we see it, you know, the interesting debates of whether science is right or not. Who do we believe? Who do we trust? And we're very worried that if we don't truly ground ourselves in credible information and in orchestration of messages, especially right now around COVID, what we're going to have is potential outbreaks. And we're going to have a divided society that uses the limited energy and resources we have to divide and separate and create polarization. And that moves away from delivery of services. And so therefore, children, youth, and adults are going to go unprotected. So we have to make sure that we remain grounded in science, and that we promote vaccines, and that we don't allow these movements that are well organized to take over. Our worst scenario is that the anti-vaccine movement in the United States could move into Mexico, and so therefore it could create greater disruption. And last but not least is climate change. And the weather events. And this is also what my colleague Peter makes a very important case of how the warming of the temperatures can also increase insect and vectors, and therefore can generate disease transmission. And also, you know, we barely touch on the fact that yes, pandemics are real. And if they happen, the US-Mexico border region is a region of the world that again shows the limited infrastructure that we have. And so therefore indicates that we are not ready. However, we pretty much end our chapter with highlighting that there are recommendations in place. But it's going to require incredible political and willingness of both countries at all levels. That also involves academicians, scholars. It involves, you know, public and private health sectors to come together to begin to agree. I think we move away from agreement. And so now we need to come back to tackle the priorities of the region and do so in a way that is really meaningful. We need to use evidence-based practices. We need to look at science. And we also need to look at incredible and important innovation. In closing, COVID-19 has come to, I say, magnify. There's nothing new. When you sort of like look at COVID, I just think of it as, okay, you gave me a magnifying glass, and very clearly, it's sort of like I'm putting my glasses and I can see you clear. I'm beginning to tackle and see the greater inequalities in health and access primarily associated with communities of color. So who's affected by COVID-19? Basically older people, that's us, that's me. Young people, that's our children or grandchildren, that's women primarily who are leaving the workforce or having to take now multiple roles. People of East Asian ethnicity because they're being singled out for being associated with the COVID. People with mental and health problems because they're going without adequate care, they're in isolation. People who are substance users or who are in recovery, people with disabilities, people with reduced communication abilities, especially those with learning disabilities or limited literacy. Homeless people, people in criminal justice systems, undocumented or semi-documented immigrant and migrants. Workers of precarious contracts or self-employed. People of low income, and people in institutions such as care homes and those with special needs, prisons, migrant detention facilities, and so forth. So that's a good number of those that reside on the US-Mexico border region. So let me stop there to allow for maybe a few minutes, a couple of minutes of questions or comments. Again, this is a fantastic book. We're already using this book at the University of Texas at El Paso for our graduate classes. We're moving into the area of social work, and so we're experimenting with it. Ask me in about a month from now to see what the students say about its value and its aportación. And so with that, I will stop. And I know my colleague Sylvia had to leave. Sylvia is in the trenches of COVID-19 response and human resources in Ciudad Juarez. And so she texted me and said, we have a crisis. It's like, Houston, we have a crisis. I have employees that are coming out positive and I need to take care of that. So she apologizes. I don't know if she's back or not on the line, but she had to step out.
How interesting. Thank you so much, really, Eva, for this insightful presentation. Let me connect with diabetes, right? The queen of the expenses, and how diabetes had, you remember that with COVID was also one of the most, one of the most exposed patients, the ones with diabetes. So I mean, definitely we need to address this disease from a large aspect that the one we are actually doing right now. So very interesting as well. And also the fact that no walls can keep diseases. We have seen that during COVID. There's COVID didn't see or didn't trust or at least follow any border or any distance. Even when we tried to close nations abroad, when once already it was inside, it was very difficult, and it keeps on being very difficult to address. Of course, it's been treated, and maybe what we envisioned with Sweden, that they were from the minute one trying to attain the herd immunity, and the international health community were a bit surprised about that. And down the line, what we might expect, the time we wait for the vaccine is at least to get the best immune, to get the immunity to COVID. So it was really, really interesting. I don't know if there is any question by our participants. Would you like any of you would you like to add something? No, I had on the chat information about where we could find the book and the title. So the title of the book, we saw it's The Future of US-Mexico Relation, Strategic Foresight. You can find it at Arte Público Press at the University of Houston Press, and it's under the Law, Policy, and Society. You can find it on Amazon. You can find it on the webpage. I'm also fascinated, Eva, let me tell you about the fact that you are already using the book in your classes. I think it's amazing that we could use this book in the different topics, and it really goes transversally and multidisciplinary in many classes, because we can see it in social work, we can see it in health law classes, we can see it in political sciences, energy, from engineers to health law, I mean, so from energy law. So really, that's a fantastic initiative. Are you seeing already, are you having some type of replies from the students? Are you having a little bit of an insight so far?
You know what's the beauty is that it is actually the chair of the department that is using it, because sometimes when you contribute into books, it's like, you know, it may come across like you're self-serving. Mm-hmm. And so the beauty of it is that I put it out to the universe and I said, here it is. And so the chair and my colleague that manages the MSW, the Masters in Social Work program, are using it. And what they're trying to do is, to the degree that is possible, engage authors. And so I'm coming, I think, to the class in a couple of more weeks to talk about our specific chapter. So I still don't have the direct feedback. Now, I'll tell you what I did. The first book that I got, I went ahead and sent my complimentary book to my university president. Because like many other university presidents, you know, my colleagues the administrators are thinking about foresight exercises. And so my university is going through a foresight exercise of this strategic planning and doing. And I said, okay, so part of our strategy is to be able to have a better and working understanding and relationship with Mexico. So here's a gift. Look over, because I think this kind of tool will be instrumental for decision makers in helping them understand what are the big picture things, and most importantly, what others from different disciplines are also contributing, and what are some of the key questions that are being asked. So I look forward to having a conversation with my university president about sort of like, well, is the book any good, you know, from that perspective? But if so, here's a resource now available to them.
Oh, excellent. Excellent. Andy, I would like to ask you something. You were mentioning about the increase of interest in the futurist methodology, and that you, in terms of students applying to your degree. Did you see an impact of COVID in the sense in your research, in your task? I mean, are you seeing that you are being more contact? Are there people more worried about the future now? How is it?
Yeah, unquestionably. I mean, we track our inquiries over time, and it just spiked. Use the verb. It spiked, and it was basically like, well, how did this happen? Why weren't we ready for? This is like this. We got to get better at this. So it's definitely a huge motivation to say, we've got to get more informed about. We can't be caught, kind of caught napping anymore. So yes, it was definitely direct result of the COVID. Yeah.
So, for example, are they already questioning when are we going to go back to normal? For example, is there a when type of question? Because we don't know how the new normality is going to be.
Yeah, I mean, there's actually a ton of like post-COVID scenarios. A lot of futurists have done a lot of work on that. I would say that one of the things we went back and looked at like past big disasters, and while you're in it, there's always this sense that like life will never go back to normal. It's and it may take a few years, but we will get to maybe a new sense of normal, but we will get past it. And I mean, like, so there is that. This sense, that's why we say the rest of all the other issues that we're dealing with didn't stop. Like, we still have a lot of work to do. So don't forget about the future, please.
There is this very important French entrepreneur that was approached about COVID, and I like the line he said about it. He said that COVID has allow us to accelerate our life in 10 to 15 years. So actually maybe in 10, 15 years, we would be all working more from distant or remote situations, working more remotely, and something that was already there in the mind and was already actually technologically feasible because of the reality and aspects that you mentioned very well about parking, right? About how everything, all these new business scenarios are going to define, because there's businesses that of course are in a terrible crisis, but others that are really improving, right? So everything that can be done online. So he said that this had accelerated something that was eventually going to happen, and now we have to be again sharing if we want it to keep on going that way, or we want to go back to how it was, because we might be available.
Right.
So
Andy, I have a question very briefly. How do you I mentioned the COVID-19 and other black swan issues. How do you deal with those kinds of unforeseen events in your modeling?
Yeah. Well, I can tell you that the global pandemic was, one of the most forecast surprises in the history of futures work. I actually pulled out. We wrote a global pandemic scenario brief in 2005, and I know lots of other folks did it. Now they're great, right? So what? It's like you can know that something like this is inevitable. You don't know the timing. So what can we do? Well, we can have if you will, we can develop an emergency response capability to deal with, whether it's the COVID, but some kind of public health. It's the increase of international travel. I mean, and it was inevitable, right? So the opportunity was to have a response system in place. You couldn't necessarily time it, but you could know it's going to happen. Let's be ready. And unfortunately, that didn't really happen, right?
okay. Well, thank you.
Thank you.
I don't know, do we have any other questions? I think we're good to go. So thank you so much. Thank you, Tony. Thank you, Eva, Silvia. Sorry that she had to leave. Andy, it was so clear. Always a pleasure to listen to you, and how you really explained so clearly this methodology that I have to tell you that when you are applying it, it's not that easy. It's easy.
No, it's not. You guys the authors did a great job, and I was really pleased to see the final product.
Thank you so much. Tony, maybe you want to say a few words before we leave?
No, all I can say is, so we got some more work to do. Alfonso will have to pick up another project, and I think now that we know a little bit of this methodology, it should become an indispensable theoretical tool for our work. So thank you.
Thank you so much to you all, and stay tuned for the next seminars. Thank you so much.
Thank you.
Bye.
Bye-bye.
Bye.